Those people who hate their arrived child, they're probably not going to love this new study that was just published. When discussing their arrived child, there are a couple of key talking points I see people make about why this study isn't a good study. Those talking points are usually around the fact that the physicians who were involved in the study were not blinded to the patients, so that they were extra patient with their labors more than they would be in normal situations. The other one is about informed consent, and that people didn't really want to sign up to be a part of a trial, and that therefore that can also skew the results. A retrospective study was just published in JAMA that looks at similar situations that the ARRIVE trial was looking at. So elective induction versus expectant management, but looking at it retrospectively. So this means instead of like putting two groups against each other and seeing what happens, we already knew what happened, and now we're going backwards and looking at what the criteria was for those people. So in this study, they looked at over 400,000 laborers between 4 years in California across all different types of hospital settings. They then looked to see who was electively induced, because we were doing plenty of elective inductions prior to the ARRIVE trial, and compared those to those who just had expectant management. And I will not say that I am not surprised by these results. For those who chose to be electively induced at 39 weeks, they had a decreased risk of a C-section, decreased risk of chorioamnionitis, decreased risk of postpartum hemorrhage, decreased risk of serious neonatal complications like neonatal ICU admission and neonatal distress. Interestingly, because they looked at such a broad range of patients across the entire state of California, which is quite diverse in their population, they found that overall urban areas did better with inductions and had those lower rates of complications. My guess is because those centers are more used to dealing with complicated patients, and therefore are also very good at managing an uncomplicated but elective induction. The thing I like about this study is that it kind of takes away those talking points that were made about the ARRIVE trial, because these patients didn't have to consent to be a part of the trial, and also the doctors didn't know that eventually someone would be looking at their outcomes. As always, I will say, if you don't want to be induced, please don't get induced. But this just continues to support the fact that elective inductions can be beneficial if desired.